This is one to keep an eye on. Australia's drug watchdog has issued a warning about medicinal cannabis. The number of prescriptions has skyrocketed, the market is booming, and the Therapeutic Goods Administration is worried it's being driven by the recreational market and use. Between January and June, more than 290,000 patients began treatment. In the same period 3 years ago, that number was sitting at 3,000. The TGA is concerned the medicinal market is pushing the boundaries. They say the prolonged therapeutic use of unapproved medicinal cannabis products calls into question the appropriateness. We have to place the risk of prescribing these products with the medical profession, whilst an unregulated industry continues to grow. According to the TGA, low-risk cases are being approved in bulk by GPs. And along the way, the product is making its way into the recreational market. Jeremy Buckingham from the New South Wales Legalise Cannabis Party has been good enough to join me here in the studio. Jeremy, good morning to you.
Good morning, Mark.
Wonderful to see you. Does the TGA have a reason to be worried? Is the medicinal product making its way into the recreational sphere?
I think it's fair to say there's an element of that, but overwhelmingly, Australians are choosing medicinal cannabis because of its therapeutic benefits. The TGA recognises some medicinal cannabis products, has them listed, and Australians are seeing its benefits for neurological disorders, pain, anxiety, epilepsy, and they're voting with their feet. So we welcome regulation. We need a regulated medicinal cannabis market, and ultimately we need to move to a legalised cannabis market so we don't have this crossover that we're beginning to see.
Those numbers are staggering, aren't they? 3 years ago, 3,000, and between January and June, more than 290,000 patients began treatment. That's a big jump.
That's a big jump because Australians are choosing it because it works, and also because they would rather take a much milder medicine like medicinal cannabis than opioids. Australia and the world has an opioid epidemic. 1,600 deaths in Australia every year, accidental overdoses from opioids. That's more than the road toll. People want to manage their pain and take a medicine that's not going to kill them. That's why they're choosing medicinal cannabis.
Well, I'm not taking anything away from that, but those numbers indicate to me that there are people getting around this, and they're using loopholes to get their hands on medicinal cannabis. How are they getting around that? Is it the doctor's fault? Is it the individuals themselves? What are you hearing from people out there living in the real world?
Well, out in the real world, the majority of people are taking it for legitimate medicinal reasons, and the integrity of the system is down to the approved prescriber, the health practitioner who is talking to the patient, working out whether or not medicinal cannabis is right for them. And so the integrity of the system is down to our doctors. And I have faith that the vast majority of doctors will be doing the right thing. If someone turns up, they don't have a legitimate reason to be getting medicinal cannabis, they shouldn't. And so the system is down to the relationship between the doctor and making sure they're prescribing the right thing in the right way at all times.
So you're comfortable that in 3 years we've gone from 3,000 people needing medicinal cannabis to 290,000?
Absolutely, because it's got a massive benefit in terms of health. People are looking at medicinal cannabis for their pain management principally and saying, I would much rather take a very mild, non-addictive medicinal cannabis than take an endone that can end your life. 1,600 opioid deaths in Australia last year, not one from medicinal cannabis. It's a lot safer, it's a lot milder, especially when it comes to managing pain. So many people choosing it, especially sports stars we see, Andrew Johns, Lauren Jackson, a lot of former footballers dealing with long-term pain issues are using medicinal cannabis, CBD, rather than endones and other codeine, which is far more addictive and dangerous.
So if I go along to a doctor, hypothetically, right, and I say to the doctor, I'm suffering from one of these ailments that requires medicinal cannabis, the doctor writes me a script, I go along. Where do I get it, and how much does it cost?
You can then go online. There's an online portal. The doctor will give you a referral to. You lodge your prescription. You go online, and then there's a range of products that your doctor has prescribed to you that you can access online. You tick those, then it turns up in the mail. It's very expensive. It's not covered by the TGA, so there's no subsidy for it. It is still very expensive, and that is why some people are still choosing to get the medicinal cannabis through the black market. But you go online, you tick the boxes have been ticked for you, and the either the oral fluids, the oils, the leaf arrives in the mail in the next day or two.
All right. I'm just having a look here. So, as you've touched on, the leading reason for prescribing cannabis is to treat pain, but there is some new research out of the Monash University. It suggests medical cannabis doesn't work to treat pain. What do you say to that?
I say that medicinal cannabis has been illegal, and there's been a war on cannabis for 100 years. So we are just getting the research we need to establish the efficacy of medicinal cannabis. And I can point to lots of research journals where there are credible researchers saying that medicinal cannabis works. So there's competing views, but there's a lot of vested interest in this area, Mark. We've got a huge pharmaceutical industry that makes trillions of dollars a year out of pain management, and they are competing for market share. People are voting with cannabis with their feet for cannabis because it works for sleep, anxiety, pain. It's working for them. If it wasn't working for them, they wouldn't do it.
Personal question. Do you use medicinal cannabis, and why are you so passionate about it?
Yes, I do use medicinal cannabis. I use it for anxiety. I was prescribed by a doctor. Infrequently, I have issues with anxiety and sleep, and I take it, and it helps me enormously. Why am I so passionate about it? Because I've seen it save people's lives, literally make the difference between whether or not they can function or not. A young woman I know, MS, 2 young kids, can't operate unless she's got her medicinal cannabis. A lot of other neurological disorders there she's got. That makes the difference to her life. So I'm passionate about it because I want to see an industry grow that's safe, that's regulated, and ultimately when we will move from a medicinal cannabis industry to a regulated, legalised cannabis industry. It's what's happened in America, it's what's happened in Canada, it's what's happening around the world. We need to make sure it's safe. We can do that. The system we've got here in Australia is actually setting that framework, so that's why I'm so passionate about it.
Well, Jeremy, I've read all of the different examples of why this is beneficial, and I agree with you. There is definitely people who use it to their advantage for a whole range of different reasons, but I just come back to those numbers. If there are people getting around the systems that are in place, and they're exposing these loopholes in the system to get it and use it in a recreational way, well, that's a concern for me. But good on you for your advocacy, and there's a lot of people out there, I'm sure, like you, who use it and use it to their advantage.